Hi everyone, welcome back to the MQ Health Wellness Series. My name is Tim and I'm a general practitioner at MQ Health. Today's topic is about getting more out of your healthcare visit by being better informed. We'll be going through questions to ask your doctor. Now you might be thinking, hold on Tim, I already do that. And yes, when you break it down, most of us consult a GP with a question or a problem in mind. But have you ever come home from the GP feeling like you're missing some details? Maybe you're sitting down at the kitchen table with a new box of pills, or you're holding a referral in your hand for a test you've never had before. Some questions might come to mind. What are the side effects of this medication again? What happens if I don't get this test? Are there any alternative options? At this point, maybe you pull out your phone, you do a search online. But when it comes to accessing medical information on the web, there's a lot of it out there, and there's a tendency to go down rabbit holes. How do I know that information is right for me? Today's topic is about avoiding this situation. And the best way to start is by knowing what questions you can ask your local doctor. I've included some key resources in this slide that are relevant to today's topic. I will be referencing them throughout the presentation. So the first step is to prepare a summary of your health problems. You'd want to tell the doctor about your illnesses, operations, medical conditions, and other healthcare providers you see. It's a good idea to bring a list of medications with you. Some patients might place their medications in a bag and bring them to the appointment with them. Knowing your family history can be helpful in identifying if you're at a higher risk of chronic disease, some mental health conditions, and even some cancers. Knowing this, we can then take steps to reduce that risk. People with a strong family history of bowel cancer, for example, may be offered a colonoscopy a bit earlier than the general population. Next, with your summary, you want to make a priority list of what you want to discuss. For example, is it the new symptom you want to ask your doctor about? Maybe it's time to get a flu shot. Are there any health assessments that you're interested in? I now wanted to point out a useful website, Health Direct, which is government funded, and they provide quality, approved health information for Australians. They have a really nice question builder on their website that can help you prepare for your medical appointment in just 4 steps. At the end, you can print out the list and you can take it with you to your appointment. I've just prepared this next slide with some general items that your GP could help you with. I don't think anything on the first half of this list is going to surprise us. Sleep, nutrition, safe alcohol consumption, smoking cessation, being physically active, and taking care of your mental health can all have a huge impact on our overall health. The next few I think are important for asking your doctor about things that may be beneficial for you. Skin cancer checks are particularly relevant for us living in Australia, where we have the highest incidence of skin cancer in the world. Now, current guidelines don't recommend population-based screening for melanoma, but the fact of the matter is, about 2 out of 3 Australians will be diagnosed with some form of skin cancer by the age of 70. And the sooner that skin cancer is found, the easier it is to treat. The best way to ensure skin cancer is found early is to get to know your skin and what is normal for you. I would suggest checking your skin from head to toe every 3 months. Any changes in shape, color, or size of an existing spot should be checked by your GP. Now we have to think about getting support. Let the staff know if you need an interpreter. There are free services that they can access for you. You can take a relative or a friend with you if there are parts of the consult you are unsure about. Now on to time constraints. There may not be enough time to address everything on your priority list. Sometimes you can't control if a doctor is running late, and I would consider making a longer appointment if you are a new patient, the problem you want to discuss is complex, or you need to discuss several issues. After the consult, you may want to make a follow-up appointment to ask further questions and discuss issues, or tell your doctor about a decision you've made after time taken to consider your options. Clear and honest communication with your doctor is important. It can help you both make informed choices about your health. You can expect the doctor to give you clear and adequate explanations. You should tell your doctor if you don't understand anything, or if something is important to you that hasn't been discussed. It's okay to ask them to repeat or clarify the information. For me, retaining information is easier with visual aids or written information on hand. I can't be the only one here who watches TV with the subtitles on. Pathology Tests Explained is a not-for-profit group managed by Australasian medical and scientific organizations. I highly recommend their patient information sheets, which are evidence-based and easy to read with helpful visual aids. There are many kinds of tests you may need, such as blood tests, urine samples, X-rays, and CT scans. Some tests are simple with a clear benefit. If you've fallen over, you might get an X-ray to rule out a broken bone. But there may be disadvantages for you to think about as well. Some tests are screening tools. They can't be used to make a diagnosis. Others, like prostate markers, require further testing afterwards with an abnormal result. Here are 5 simple questions by Choosing Wisely Australia that you can ask your doctor before you get any test, treatment, or procedure. Do I really need this test or procedure? What are the risks? Are there simpler, safer options? What happens if I don't do anything? What are the costs? On to discussing your diagnosis and what to expect. A diagnosis identifies your disease or physical condition. The doctor might make a diagnosis based on your symptoms, the physical examination, or any tests that may have been ordered. Some medical problems we don't have a cure for yet, but they can still be treated or managed. Understanding your medical condition will help you make better decisions about treatment. If you know what to expect, it may be easier for you to deal with the condition. I've just got a list here of some useful questions that your doctor can help you with. What is the name of the condition? Is it known by any other names? How serious is this condition? How long will it last? And what causes it? Can it be passed on to other people? Would it be getting better or worse? Are there any other health professionals that should be involved in my care? What can I do to improve it myself? Where can I get more information about this condition? Asking questions about your medications is important. It is always your right to decide whether or not to follow your GP's recommendation. Now, medicines work in different ways. Some reduce your symptoms, or sometimes, start that sentence again. Medicines work in different ways. Some may reduce your symptoms, others may prevent illnesses or complications. Ask your doctor about the expected benefits, and then think about what those benefits mean for you. Side effects are unwanted effects of a medicine. All medicines can cause side effects, but not everybody will experience them. It is important to be aware of side effects so that you know what to do if you experience them. There may be other medicines to consider for your condition. Some may be more effective, but have a greater risk of side effects. It is important to weigh up the pros and cons of each treatment option that is available to you to make an informed decision. Now, I know on the slide it seems like a lot of questions. And as I mentioned earlier, there may not be enough time to go through all these questions at your consult. Your local pharmacist is another healthcare provider that can help you with your questions. Barring that, there is a telephone service I would like to refer to. 1300 Medicine is a free service available to all Australian consumers. The phone lines are staffed by registered pharmacists who can help you understand your medications. During your visit, some clinical measurements may be taken, including your height, weight, blood pressure, and waist circumference. These measurements are used to identify and monitor certain chronic conditions, such as cardiovascular disease and diabetes. Maintaining a healthy weight and blood pressure may be the difference to avoiding more invasive treatments and long-term medications. Now, what is considered a healthy number for one person can differ to another, so it's best to ask your GP. In general, if a blood pressure is over 140 systolic and 90 diastolic on two separate occasions, that is high blood pressure, and I would talk to your GP about ways to address this. Summing up, you can get more out of your healthcare if you're well informed about any treatments, medicine, or tests that your doctor recommends. Asking questions can help you understand and make the best healthcare decision for you. As always, don't hesitate to get a second opinion or seek out further information.